What do you say to a medical doctor who is not opposed to acupuncture, but at the same time does not really understand it? How do you explain acupuncture to somebody like that who went to a different school of medicine, but really is looking for more solutions for their pain patients, for their, this could be an ortho clinic that, sees injuries all day long. What do you say to them?
So that's a pretty common experience to have is, more or less a patient comes in and says, well, my ortho says they don't understand acupuncture, but they think it's great and they think it works. So they're all for me continuing seeing you. I just recently had a patient who had knee reconstructed, and she went in her PT the day after she had acupuncture. She already had 5 more degrees of flexion, and the PT was so amazed when she was doing some of the manual work at the acupuncture. So, you kind of have a lifer then when you have an experience like that as another practitioner, even if you don't understand the medicine. I don't understand half of the medicines out there, or all of the medicines out there to the extent that I understand acupuncture. But I talk to them in very basic terms that, I'm going in to release a muscle. I'm going in to nourish a joint, to have the body pay attention. I don't start talking about chi, blood, yin, yang. I can't get into that realm because they're not going to understand it. If they're willing to meet me halfway on the bridge, I better be willing to meet them halfway on the bridge and talk to them in terms that they're going to understand, that PTs would use, that chiropractors would use, people in an industry that they're used to working with. So I talk in the same kind of, injury prevention, treating an injury, releasing a knot, releasing a contusion, working with a concussion and the cerebral spinal fluid, talking in the terms that they would agree and would understand.